Good morning, everyone. My name is Rohan Rangi, and my student ID number is 199367752. Today, I'm going to discuss a very common and critical mental health issue known as major depression. My whole presentation is going to focus on people living with major depression. Major depression or depression is a mental health disorder characterized by persistently depressed mood and long-term loss of pleasure or interest in the life. It often has other symptoms such as disturbed sleep, feeling of guilt or inadequacy, and suicidal thoughts. I will start with my presentation with the status and data based on incidence of major depression. I will then discuss the challenges faced by people experiencing major depression. Then I will talk about the recovery-based interventions as a nurse that we can take to help and treat those patients. At last, I will talk about the initiatives led by Australian government to help those people who are suffering from major depression. As we have discussed before, all mental health disorders, especially major depression, is a big burden on the healthcare industry and society. According to an article published by BJM, approximately 20% of Australians are diagnosed with depressive disorders in their lifetime. A consequence of this high prevalence impact on function and risk to later ill health, premature death, and substance use disorders in the life. Moreover, according to a survey experiment that was done on 20,869 people having depression, we got to know that 75% of those people were female and the rest, 25%, were male. The reason behind women having more cases of depression than men could be because of the social stigma against women, pregnancy, and early puberty, etc. Furthermore, in this survey, the age range was between 18 to 90 and the median age was 43. Do you know 1 in 16 Australians are currently having major depression, or we can say 6.2% of Australians aged between 16 to 85 have been diagnosed with major depression in the last 12 months, thanks to the statistical data from the Beyond Blue Foundation. Furthermore, Aboriginal and Torres Strait Islander people are 3 times more susceptible to depression due to the historical events that they have encountered, and some of them are still facing those events. For example, stolen generation, discrimination, inequality, loss of cultural and natural heritage, and destruction of the communities. Major depression can lead to many psychological, physical, and social problems for the people who are living with this disorder. To list a few, people experiencing depression may have the feeling of hopelessness and sadness that may linger and affect their day-to-day activities. Poor concentration can also be a byproduct of major depression. This could happen because there is a change in cognitive state in the brain with the patients who are having major depression, which can also lead to trouble remembering things and making decisions. Muscle weaknesses and fatigue could also be caused by low energy levels, which can happen because of prolonged depression. It is one of the physical symptoms of major depression. Another physical symptom could be lower sex drive, as depression leads to lack of interest in activities that we usually enjoy, and sex is one of them. Moreover, the social problems that a person experiencing depression could face are withdrawal from the society and family, as the person suffering from mental health disorder like depression tends to live and stay away from everyone and tries to live alone. The person could also start using illegal substances like drugs and can also increase the alcohol intake, which could be fatal. To add a bit more, the person may become suicidal and lose interest in their life, as they try to end their life because they may think this is the best way to deal with the depression. Now we are going to talk about the recovery-based model interventions that can be taken by the nurse to treat and help patients experiencing major depression. Recovery is not as same as a cure. Recovery means being able to create and live a meaningful life and contribute to your society and your community, which could occur with or without the mental illnesses. As we all know that everyone is expert for their own health and well-being, the recovery-based model involves working in partnership with the individual and the carers to provide support in the way that makes sense to them. It is important to share information and need to communicate clearly, which involves working in positive and realistic way with the individuals, families, and the carers to help them realize their importance, goals, and their aspirations in the society. This intervention is what we call partnership and communication. Another intervention that we can take is that we can help the consumer to maintain his dignity and respect, which involves sensitivity and respect of each individual's, especially for their values, beliefs, and the culture. Furthermore, as we know, everyone is unique. So we should try to prevent the care that is one fit all and see every patient differently than others. Even though they may have similar symptoms, they are different people. By having a positive attitude against the patient's condition and having a therapeutic relationship with not only the patient, but also with his friends, family, and other community members can help us and the patient to accelerate the recovery process, as the patient is very best and well known to them. It will not only help us, but will help the patient. There are many initiatives led by Australian government to help people dealing with mental illnesses. For example, Health Direct, e-mental health practice, Are You OK Drive. But today, I'm going to talk about Beyond Blue organization. It is an independent, non-profit organization supported by federal government of Australia and every state and territory government in Australia. Beyond Blue has been providing support and services to people in Australia for about 20 years now. Beyond Blue Foundation is Australia's most well-known and visited mental health organization that focuses on supporting people affected by anxiety, depression, and suicide. Moreover, it works with community to improve mental health and prevent suicide, so that all people in Australia can achieve their best possible mental health and contribute well and very well in the community. Their aim over the coming years is to streamline access and provide responsible care and for their big blue doors. Furthermore, they also want to build a better online platform to connect with people in the community. They achieve their goal. They will achieve their goal of helping community and people by actively connecting with people with evidence-based practices and services to support improvements in mental health literacy.